According to the United States Agency for International Development USAID's report, health indicators in Nigeria are some of the worst in Africa. The country has one of the fastest growing populations globally, with 5.5 live births per woman and a population growth rate of 3.2% annually. It is estimated to reach 440 million people by 2050. With its rapidly growing population and development challenges, the country drags down the socioeconomic indicators for the entire African continent. To help address its high mortality rates, USAID supports increased access to quality family planning and reproductive health services, immunizations, polio eradication, malaria prevention, and maternal health services. They work with the government to encourage greater budget expenditures for health. In partnership with the Centers for Disease Control and other partners, they assist Nigeria to build its capacity to manage HIV/AIDS and tuberculosis cases by strengthening the primary health care system and focusing efforts on prevention, detection, and treatments throughout the country. Despite the collaborative efforts of both governments, donor agencies, and NGOs to provide an efficient and effective healthcare delivery in Nigeria, confronting problems render these efforts much less than desired. Some of these challenging problems include emerging and re-emerging health problems, such as HIV pandemic, inadequate payment of health workers' salaries, poor quality of care, inequitable health care services, brain drain, and irrational adoption, appointment of health workers, among others. Today, on your regular Health TV talk show, The Physicians, we'll be discussing public health in Nigeria, challenges, gains, and what else the way forward. Stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, your regular anchor on this program. And of course, I'm not alone. I'm with my very elegant co-hosts.
I remain Dr. Memuna Yusuf Kadran, of course, on your favorite Health TV talk show. Your health is our business, of course, with The Physicians.
Will always be our business.
Exactly.
Finally, we are going to be discussing a topic that is also very interesting: public health in Nigeria, gains and challenges.
Yeah, because public health, everything is public. Even if you say some areas of medicine, maybe respiratory health, mental, when you still look at it, it's still on a public level, yes. Because at the end of the day, for us in Nigeria, it's serving over 200 million Nigerians. So public health is key.
From the report that the USAID said is by 2050 we'll be hitting about 440 million.
Exactly.
So if we don't have the things on ground to manage, if we don't have the right statistics,
we don't see this 200. That's why census is important. Not they've been dialing on census.
Yes.
Trust me, I'm sure when they do census, this 200 million.
Million we are talking about.
Because even when you go to some communities, you look at
more than 200
million. There was one room, like 20 people will come out from it. So that is one. Then COVID opened up a whole lot of rot in the health system, meaning that we need to put certain things in place. Remember, the WHO is already talking about one virus like this now in recent times, as if
not again, not again. So we have to be prepared.
Then, of course, our major problem in Nigeria is that, yes, if we put this infrastructure... Maintenance is a major problem. Human resources.
Now we have brain drain.
Syndrome.
Brain drain, a lot. So because it's not even only the doctors that are going now.
Technology can't
drive everything. Thank God we have a super guest.
No.
That is coming to discuss.
This super, we need the name for her.
Yes, she's coming to discuss the gains and the challenges. General Overseer of Public Health. When she comes back, we'll meet our General Overseer of Public Health back after the short break. Stay tuned.
Every day and in in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to a regular health TV talk show, The Physicians, where your health is our business. Today we're discussing public health in Nigeria, the gains and challenges. And in the studio with me is a consultant, public health physician, an associate prof, Dr. Alero Roberts, with the College of Medicine, University of Lagos. Dr. Alero, you're welcome to our program.
Thank you. Thank you so much for having me.
You're welcome.
I will know we just nicknamed her
The
General Overseer,
of Public Health.
General Overseer of Public Health.
That title is a bit too big for me.
No, it's not. We know we have some.
Because you always bring it down to the level where everybody actually just follows you.
We have egg bones there. We have
Yes.
our big organs there.
I am
But the
honored.
truth is that your advocacy for public health is immense
Yes.
in the society.
The love for it is actually amazing.
I'm telling you,
Yes.
Because I know what I see. And
Yes.
I know what people are going through.
And that is what the
Okay, we know there's always no time when it comes to review. There's always not enough time. So we're talking about public health in Nigeria, the gains and the challenges. Let's first of all talk about what is the public health. What just comprises public health? They will not talk about the gains and the challenges.
Mine is very simple. My definition of public health is the health of everybody, from the person through the family to the community, state, nation. So you are going from here, me personally, those who are my immediate concern, immediate and extended family, my community, everybody's health. And that's why, public health is everything. It's not just medicine, like Dr. Memuna said earlier. It is not just medicine, it's law, it's sociology, it's psychology.
It's all encompassing.
It's engineering, it's buildings, it's roadworks, it's agriculture, it's water, it's everything.
Okay.
Everything finally boils down to the public health, because that is who we are. If we're not healthy, we can't do anything. We can't even get out of bed in the morning.
Okay. Like the unit report said, it said we're actually the indicators were the ones actually pulling the African continent down.
We are so many.
Yes.
We're so many. So it's a numbers game.
Yeah.
So if you said we are going to 440 million by
2050.
And my heart actually wondered, and I said, if we don't do something, we may not get to that 440 million by 2050. The truth of the matter is that the mortality rate may outweigh the birth rate. And that's going to be a problem. Not
That's
that
true.
I want us to get to 440 million, because that too has implications.
I didn't even look at it from the light.
Oh, yes, that's the problem. Everybody's looking at the birth rate, but we're not looking at
the
the
mortality rate.
And we're having mortality not just from women dying in childbirth, not just from infants. We're now having mortality from non-communicable diseases.
And
We're having mortality from strife, mortality from conflict, mortality from natural disaster and man-made disaster.
I saw one report says every 2 minutes a woman dies.
And that's just the women dying.
That's not the women.
Childbirth.
Non-communicable disease so high because hypertensive, heart diseases, cardiac diseases, obesity, cancers, mental illnesses. It comes with a lot of.
Okay, so where do you want to start from? The gains or the challenges?
Well, let's look at the gains, because it's always more interesting. Or we'll sandwich the gains, we'll sandwich the challenges in between gains and gains.
Okay.
Because that's the way to look at it. Because the gains in and of themselves also lead to challenges. You know what they say? New levels, new devils. So that's just the truth of the matter. I mean, we've had so many gains in the last 4 administrations. But very often, like somebody said earlier this morning, when you don't understand the thing, we are quick to criticize and pull it down without actually realizing that we have actually made major gains. I think one of our biggest gains would be in the area of disease surveillance. We've made huge strides in that, and the beauty is that we are leading the world, we're leading the African continent in strategies to improve disease surveillance.
That's good.
Where we are not winning, perhaps, is when we have now done the disease surveillance. What are we doing about managing and treating the disease?
Yeah.
But you see, that has a personnel and a personal input to it. Because you mentioned hypertension. If I tell somebody, sister, it looks as if your blood pressure has gone up, you're going to have to be on medication for the rest of your natural life, God forbid, it's not my portion. And then he promptly doesn't take the medication and it becomes a mortality statistic. Well, whose fault was that? Do you understand what I'm saying?
Yeah.
So these are the things that very often gains are being masked by these ongoing challenges, which are also not only personnel driven, but personal driven.
Yeah.
And that's something we need to look at.
Mindset, behavior.
Mindset and behavior. Very, very key.
Okay.
So we were the 93-day wonder for Ebola.
Exactly.
And that was based on our disease surveillance strategy for polio. We've managed to kick out the polio. We've managed to reduce our tuberculosis incidence rate.
Yeah.
We've managed to, we're slowly getting ahead, despite what many people in Nigeria will see as major challenges with personnel. But we are slowly making our way. The truth of the matter is that when you now look at it's things outside of the health sector that are now proving to be challenging. There's nothing the health sector can do about security.
Exactly. And it's a major key indicator in ensuring good health.
Thank you very much.
Yeah, that's true.
There's nothing the health sector can do about power. And without power, there are so many things that will not work at the health facility level. There's nothing the health sector can do about our manufacturing. And there's nothing in the health sector that we produce in this country now.
Right now.
We used to.
Yeah.
But we are, so those are things that are outside of the health sector that are now proving to be challenging to the public health of the people.
Okay. Dr. Alero, just hold it there. We need to keep a date with the physicians. We'll come back, we'll continue. So my dear viewers out there, I'm sure you're enjoying what Dr. Alero is saying. When we come back, we need to hear from you on the challenges and gains in public health in Nigeria. You have heard what he said. It has nothing to do with just the health sector, electricity, that's the power, the engineers, the road network, telecom, everything is very important. So when we come back from break, let's hear from you what you have to say about it, the gains and challenges of public health in Nigeria. Stay tuned.
Public health. So far in Nigeria, as I've grown up as a citizen and as a youth, public health has to matter with surroundings, how you are being brought up. And surroundings in terms of, especially in the case of little kids growing up, if the surrounding is not well, if it's not okay, if it's not a compatible place for kids to grow up, it's going to tell as they grow, and it's going to tell on what they will become in the future. It's very, very well tells a lot. The way you are brought up. And also, it's also going to help them health, mentally, physically, their behaviors a lot. That's how I'm going to say.
First of all, when you talk about public health is, is a way of making your community safe for people to live. All right, work, play, and go to their daily basis as like a healthy environment. You understand? That's what I actually understand as public health. When your environment is okay, conducive for people to do whatever they are doing, their daily basis, their daily jobs, and all that. So I think, but in Nigeria, I think we are trying, but we have a lot to do when it comes to Nigeria, because our government really need to help the facilities we need in our local hospitals, because there are some people in trenches that need to be aware of what public health needs to.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I find
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. We'll be discussing public health in Nigeria, the gains and the challenges. And in the studio, Dr. Alero Roberts, an associate professor of public health physician with the College of Medicine, University of Lagos. She's been doing justice to this program, to this topic. Dr. Alero, we know we're talking about the gains and the challenges, and you reminded us that it has nothing to really do with health per se.
The health sector.
The health sector only. And that we also have other sectors, both the power sector and everyone that you just mentioned. Okay, so now let's zero down. These challenges, how can we surmount them?
We need to invest in the healthcare infrastructure. And in investing in the healthcare infrastructure, we're not just talking the buildings. We have enough of buildings and everything. We need to invest in training and developing the workforce. Yeah. And as I often say, the workforce is everybody from the cleaner to the clinician. Yeah. Everybody involved one way or another in making sure that there's proper health service delivery. So we're back to education. Education has to be strengthened. We have to train, recruit, retain the health sector staff. And that is everybody. You can't just increase salary for one cadre and not make sure that the others. And then you mentioned something that is so true. You said, oh, everybody has jackpot. How do we get them to jackpot? And that is so important. And the truth of the matter is that nobody enters into the health sector, health service delivery, expecting to become another multi-millionaire. No. 99% of people that go into the health sector really want to help. So all we need to do is to make an enabling environment for them to have safe living conditions, schools for their children, safe transportation, all the tools they need to work. And they will all come back, not just the doctors, the nurses, the physiotherapists. I don't think we realize how many physiotherapists we have lost in this nation. And we need the physiotherapists, particularly when we are now talking about the non-communicable diseases. All the people who have had cerebrovascular strokes, who need physiotherapy, road traffic accidents, and they've had traumatic injuries to the limbs. They need physiotherapy. You know, these are things that we really need to consider. Something else we need to do, and again, it comes to outside of the health sector. Improving water and sanitation.
Very key.
Very key.
Very key.
That should even be primary.
It is supposed to be primary.
Because waterborne diseases
is
a health issue.
And don't just think waterborne diseases and think of the diarrheal diseases. Waterborne diseases, trachoma of the eye. Waterborne diseases, skin. Oh, thank you, Dr. Memuna. You are right on the ball with me.
There's a whole lot.
And then waterborne diseases, we have to also address this issue of malnutrition. And this malnutrition, like you quite rightly said, is both the overnutrition and the undernutrition. And what we are seeing with the overnutrition, in case people didn't think it was a problem, it's not a matter of, they have so much money, that's why they're eating. Yeah. It's because there's the wrong food available. And so you see children who are being brought up on empty calories. Empty calories.
Like a particular meaning that many families just cook. There's no protein in it.
No protein in it.
We don't even want to mention it. No, we all know Nigerians.
We all know it.
You know, 2 minutes.
Yes.
Quick, fast. You know.
And you know, it's because people are time poor.
Yeah.
You know, there's no time to prepare
properly.
Yes, that's the problem. And then, of course, we go all the way through to the other spectrum of the undernutrition. And we're seeing the undernutrition in adults, which is a major indicator of a society that's breaking down, that's facing challenges. In adults with tuberculosis, in adults with HIV/AIDS, in adults with cancers, we're seeing major undernutrition going on there.
With no immune status.
Without, yes, no, because that no immune status means you are now, thank you very much.
Yeah.
So these challenges, and it's not doctors and nurses that are going to solve this problem. Exactly. It's not the Ministry of Health only that can solve this problem. In fact, the Ministry of Health, in fairness, has every single policy document, every single strategy every single thing that it needs to solve this problem, they have it. The issue is going to be implementation, and that is where this multi-sectorial approach needs to come in.
Enabling environment is also important. So.
Dr. Alero, Robert, you know, there was that Abuja declaration, and sadly it was Abuja declaration, standing in for 54 African countries as far back as 2001, that stipulated that 50% of our budget must go into healthcare financing.
Are they doing that?
What role would that play? With the 50% first question, is this 50% even feasible? Number two, even if they deploy 50%, will it even solve the challenges we are having now? Thirdly, with this, what kind of percentage can actually help in moving forward? Because these are pertinent issues. We have seen what COVID has brought. Now WHO is talking about a new virus that is crawling small.
CCHF.
Yes.
That is scary.
That is scary.
Really
And mortality is also quite high. What? Because I want you to speak to the general public, because this is public health issue, and we know that healthcare financing is very important in everything we are talking about.
I want to ask the question. Let me flip it the other way. How much is your health worth? Which market or supermarket or are you going to go to buy health? The way we are going to buy one of these products.
That is why they say health is wealth.
Is worth. You can't.
So if your husband gives you a budget of 100 naira, is 15 naira out of that 100 naira enough to ensure your health?
The breakdown is
that is
the reality.
You say that's what I'm good at.
Yes.
Because that's the way I think it's too.
15 naira will not be enough.
15% of any of your household budget cannot, it is not enough. And this is why you find that for many people in the lower socio-economy, we've done that research, it's all over many Nigerians scientists have done that research. You find that people in the lower socio-economic brackets are spending 60-70% of their household income on health.
Making them
neglecting the other important things.
Education, neglecting the good housing, neglecting other income, empowering themselves for other income generating activities. So let's not lose ourselves on that 15%. It can never be enough. UK, US that are doing a lot more, we see what is happening there. So that is a global problem. But you said something that is key. Let us speak not to the government, but to the people.
Okay.
Because it is important. Now that I've reduced it to your husband giving you your household.
The reality.
That is the reality.
That's the reality.
That is a reality. And you think to myself, well, if I only have 15 naira in every 100 naira for health, what am I going to use it on to ensure that my health, the health of me and my family will be better? I would put it into insurance.
Exactly.
For every 100 naira, I will take 15 naira and say,
at least let us have.
Thank you very much.
We need it. We know
where to go. Because that is our biggest problem. You know where I work, and when people come and they are complaining bitterly about the poor service delivery and the poor attitude of staff, you find that at the bottom is money.
So, Dr. Alero, all you have just said now, to wrap it, apart from the other sectors coming in and playing their own path, the important thing is for us to look at insurance.
We need to look at ourselves and make sure we find our own health important enough to insure it.
So thank you so much, Dr. Alero. You have just said it all. In summary, the important thing is, apart from other sectors playing the path, we as families, as individuals, need to have at least an insurance policy that we're going to work with. Because from that analysis that you just made, 15 naira from 100 naira is nothing. But when you put it in insurance, it's a combination, and that will go a long way. So thank you so much, my dear viewers out there. I'm sure you heard what Dr. Alero said. The only important thing I want to just say is, ensure as a family you go for insurance, no matter how small it is. Save something for your health, because health is wealth. On this, I want to say thank you again for keeping the day with us. Same time next week. Ensure that you don't watch our program alone. You just come with somebody. My name still remains Dr. Martina Agbemi.
I'm sure all of us enjoyed today's program, because we talked to the General Overseer of Public Health in Nigeria, Dr. Alero Roberts. Thank you very much. And of course, please always keep a date with us. Follow us on all our various social media platforms: Twitter, Instagram, Facebook, YouTube, and now there's trends, you know. So we are all on our various social media platforms. And if you want to be a part of this show, you are just a click away. Go to our website and fill the form, and you'll be right here, just like Dr. Alero Robert is informing everybody to help demystify and, of course, give the right information when it comes to health. My name remains Dr. Mimina Yusuf Kadri. Until next time, remain blessed.